Good afternoon, I'm Becky Jenner, President of Rett Syndrome Europe, a voluntary role, but I also work for Rett UK and I'm mum to Rosie, who's 28 and has Rett syndrome. It's great to be here. I hope you're finding the conference really helpful. You heard before the break from Francois about how patient advocates can be involved in the regulatory organisations, which is going to become an increasingly important piece of work as gene therapies and drug treatments advance. But you need to have families and strong advocates to engage in this process, so I'll talk a little now about that aspect. The time is now in respect of getting our houses in order, with new therapies and treatments on the horizon. We need to be ready to engage with the EMA and the funders in each country so they know about Rett syndrome. And as the treatments are approved elsewhere, we will then be well placed to make our case about the need, the impact they will have, and how many people are likely to benefit. Knowing how many people with Rett are in your community is important for several reasons. For the families, first and foremost, of course, it's about connection, information, advice and support. Then ensuring all those that can benefit from any treatment are going to be contactable. But for the pharma and gene therapy companies, it's about viability of running a clinical trial. Are there Rett centres with experienced clinicians who can run a trial? Is there an infrastructure, a patient organisation that can assist in disseminating information, recruiting patients? Are they in contact with enough people to make the trial feasible? All these things are important. For the EMA and funders, they will want to understand what the impact of Rett is, how a treatment could make a difference, how much of a difference, and for how many people. It's also important to have a confirmed MECP2 genetic test to know the particular mutation the person has. You need to know this for any trial, but it's very possible that there will be treatments that target particular mutations. We also need to be able to show the full spectrum of Rett and find more males. It's highly likely that males with Rett remain the most undiagnosed group and therefore could be missing out on potential treatments, therapies and support. All of these families, though, have powerful stories to share and the regulatory authorities need to hear them. So how can you find more families? Social media is an obvious one and using hashtags helps, but not everyone, of course, is on social media, especially families of older people with Rett, who are also potentially amongst some of the numbers of the undiagnosed people in some countries where information about Rett syndrome is only more recently being shared. Think about having an awareness raising campaign, but you don't need to start from scratch. There are resources out there that can be either translated or adapted, and Rett Syndrome Europe will help in these endeavours. And I know other organisations are happy to share and support any awareness raising activities you do, so please reach out to them. Think about all the places people with Rett are likely to be. Target doctors, health visitors, special schools, day centres, etc. Also genetic testing centres. Here are just a couple of examples from campaigns other organisations have done. This one from Rett UK was aimed at GPs, health visitors, etc. and was drawing attention to one of the most distinguishing features about Rett, the stereotypical hand movements. And they also include the diagnostic criteria, emphasising that an early diagnosis leads to better, longer-term outcomes for both the child and the family, but also now is about having access to therapies and specific treatments. Our colleagues at Rett Syndrome.org have an awareness-raising toolkit, lots of great ideas and resources in there, definitely worth having a look at that. They've included these lovely awareness-raising cards which can be personalised and you can have information about Rett syndrome on the back. So obviously they're visually appealing and can catch people's eye. So hopefully you'll be finding more families and be ready to engage with them. Have some resources ready that you can share. Again, there's lots out there already, but you may need to get some key ones translated. Having more families involved helps spread the load and brings more skills to your group. Maybe start a WhatsApp group to connect people. You don't need to go all out to set up a registry, but a simple spreadsheet to record contact details, name and age of person with Rett, MECP2 mutation if known, would be sufficient. You will need consent protocols, of course, to store the information. You could start with some simple activities like online forums on Zoom or Teams, connecting people, sharing tips and advice, etc. Then we would suggest engaging with Daniela Trope and the Data Rep platform, encouraging healthcare professionals involved with the families to get on board. You don't need any more information than you've collected in your spreadsheet to contact the families and get them involved with this initiative. Starting another patient registry is not necessary and may well be beyond the resources of most organisations. Some other resources out there. There's this patient journey for Rett syndrome, which is on the Eurordis website and has been developed by patient reps from Ithaca, which is the European Reference Network for Rare Diseases. This is a great tool to share with healthcare professionals as well as families, as it gives a snapshot from that early development when things first start to go wrong to the comorbidities that are likely to occur later and what's needed to support the child and the family. And then I will just mention the Rett resource, which is on the Rett Syndrome Europe website. It is available in some languages and can be translated to others. Please get in contact should you wish to do that. We're also offering the opportunity for other countries to have access to the platform that we've used to do the translated subtitles on all the presentations in this conference. So again, please contact me if you're interested in finding out more about that. And there's just a few key organisations I would suggest are worth engaging with that can help you developing resources, but also providing training and support for patient advocates. So the Global Rett Leaders Forum meets quarterly online. That's organised by Page News at rettsyndrome.org. Very many people in that, and everyone's happy to help share resources and support whatever you're trying to do to develop your organisation. Then there's the Ithaca, which is the ERN, European Reference Network for Rare Diseases. They've done a lot of work specifically around Rett syndrome. There's lots of resources on their website. And then also Eurordis, we heard from Francois earlier, training and support for patient advocates. So please do look up those organisations. Thinking about next steps then, if you've got a few willing and able parents to galvanise your Rett community, develop a small action plan, but keep it simple. Think about who can help, who has time and skills to do certain tasks, and decide if you want to formalise as an organisation. This is recommended as you're more likely to be able to attract funding to support your work that way. And here's a few funding opportunities that are worth looking at. I will just highlight this middle one as it does have a March the 31st deadline, and it's particularly aimed at rare disease advocacy groups. It's a fairly simple application for up to €5,000. The other two sites provide information on sources of European funding and a funding toolkit that you might find useful. Finally, I'd like to share this slide with you. It's a good mantra to have when things seem overwhelming. And remember, Rome was never built in a day. So thank you for listening. Please do contact us at Rett Syndrome Europe for further support, and I hope you enjoy the rest of the presentations.